Since I come from one of the stay-at-home states and represent a fairly rural district, you know, a lot of what I'm going to talk about is why we should treat everything uniform. I mean, rural areas can be treated differently because the disease burden is less, the strain on the hospital system, et cetera, et cetera. So first of all, well, Dr. Frieden, you said, and I think I quote here, shelter in place is blunt but effective. We don't really have scientific data on that for coronavirus, do we? Because if you plot actually what the states have done versus the severity of the measures states have gone versus their case counts, you actually find that the states with less restrictions in place sometimes have lower case counts. An example is Florida. So we really have no data, specific objective data about that, do we? Prospectively looked at? For coronavirus, for COVID-19.
For COVID-19, if we look at information from around the world, it's very clear that when people stay home, it reduces the spread. But it's also clear, Doctor, that there are countries, including Singapore and South Korea, that have been able to limit the amount of physical restrictions or physical distancing and still control the virus. And there are differences in different environments.
So Florida, for instance, didn't put in stay-at-home, but their case rate is lower than Maryland's, for instance, right?
There are many factors that go into what the case rate is.
That's right. So my point is that shelter in place might work, but it might be just the social distancing that shelter in place obviously implies. Now, Dr. Rivers, I looked at the recommendations from AEI. They're a month old, is that right?
Yes.
So we've learned a lot in the last month, haven't we, about this disease? So for instance, as we ramp up testing, the first criteria is that your case count has to go down. Well, as you ramp up testing, you're going to find cases that you wouldn't have found. So for instance, I'm sure you're aware, there's a Michigan prison where they tested all their prisoners, 60% tested positive. They were asymptomatic. In an Ohio prison, 73% tested positive, the vast majority asymptomatic. So there are clearly asymptomatic cases around, and as you ramp up testing, so what you're going to do is you're going to be chasing your tail. Now, since the entire purpose of restrictions was to minimize stress on the healthcare system, right? Because we want our healthcare system to take care of people so that they don't die, then why wouldn't hospitalizations or ICU occupancy, even more importantly, be the benchmark? Because in Maryland, we've plateaued in ICU utilizations, but our case counts continue to go up as we begin to go into a hotspot, for instance, the processing facilities, poultry processing facilities. Well, you go in there, there are a lot of healthy people. They may have coronavirus, but they're otherwise healthy. They're asymptomatic. You're going to start testing them. You're going to find a whole lot of cases. But that doesn't mean that your community's healthcare system is overstrained. So why would you choose cases and not hospitalizations or ICU utilization as your benchmark?
I would add to your statement that the purpose of lockdowns or stay-at-home orders, it's true, was to prevent overwhelming our healthcare system, but it was also to give us time to build up our capacities to do case-based management, and I think we shouldn't lose sight of that.
So let me talk a little about case-based management, because a lot has been said about contact tracing. Dr. Rivers, what is for every case that we have diagnosed, what's your estimate of the number of cases that exist that are asymptomatic? People who are asymptomatic, they never had symptoms, so they would never be detected for contact tracing.
Emerging evidence is that about 25 to 50% of cases are asymptomatic, but those people would still be affected by quarantine.
Now, you do know in Stockholm, the estimate is that for every case that's identified, there's 73 cases that haven't been identified. Is that right? Do you know that? You're aware of that statistic?
They have not shared their scientific data, so although we have the top line number,
it's
we don't
reported.
know.
You can Google it. It's reported. So So if we concentrate on contact tracing, and that's our gold standard, is we have to have contact tracing. For every patient we contact trace, we could have 10, 20 people who are out there asymptomatic, not contact tracing. And as the description of contact tracing was, well, we're going to educate the people who are infected and the people they could have come in contact with about what the good, public health measures are. Wouldn't it be more effective if we've just educated everybody, because we really don't know who's an asymptomatic carrier. That is, educate everyone. You know, wear a mask when you go out in public so you don't spread the disease. Make sure you wash your hands. Make sure you don't touch your face, your nose, your mouth. You know, these are the things as doctors we've known for years. Look, we know how to prevent the spread of respiratory viruses. What we're doing is we're now educating the broader population. But to say that we're going to do this through contact testing and not very broad education, I think means we're going to set a standard. You know, to train 100,000 people nationwide and to institute contact tracing could take weeks. I have small business owners in my state who in my district tell me they can't last weeks. They're going to go out of business. So you tell me, Dr. Rivers, why a business owner in my district who sees 5 customers in a store for an entire day can't safely operate with social distancing, masks, and hand hygiene?
I don't think the economy will be able to recover robustly if people are afraid of getting infected in the community. And so I think it's to the advantage of the economy if we can implement and regain control using case-based
So you
interventions.
think it's dangerous for that store owner to open up their store using CDC guidelines? And we won't even get into, because I was going to ask, and maybe in a second round I will, why the WHO guidelines, the World Health Organization guidelines, are so much different from the CDC guidelines. So you think it's dangerous for that store owner to open that?
I think customers won't want to visit if they don't have confidence.
That's their choice, isn't it, on the customers? Thank you. I yield back.